Hi, everybody. My name is Avis, and I am part of the core team of the Systems Innovation Healthcare. And so welcome, and wherever you are in the world, we'll do a little exercise in a bit where that is. But start the session by welcoming you and really good conversation today with on our paper, and also just where from here kind of conversation of what's the next step, and use this white paper as a bit of a jumping off point for some now more practical and meaningful sort of discussions. So coming to you from Treaty 6 territory, and then I'll pass it over to Janine.
Hey everyone, I'm Janine Civi. I live in Pittsburgh, Pennsylvania in the United States. I currently work with small and medium healthcare organizations, nonprofits, community-based, helping them with sustainable growth. And I do that by aligning their business and product service ecosystems. I've been in healthcare for about 12 years, payer, provider, EHR platforms. And prior to that, I did a lot of systems work in other domains. So I will pass the introduction baton to Angela.
Hi, I'm Angela Kennedy, and I'm based in the northeast of England. And I've had a long career in the NHS, but now I'm independent, and I work mostly with companies thinking about their well-being, trying to become more trauma-informed in our communities, and particularly interested in compassionate leadership and how we use arts and creativity towards transformation as well. So that's a little bit about me.
And then next we can have a mini introduction from Joss, who founded the SI Network.
Oh, great to be here, guys. Good to see you all. Yeah, and Joss, along with Anya and Yasmin, we helped to develop and manage the overall SI community, and been working with Angela and Janine and Kyla the past couple of months set up this hub, and it's our second event, I believe. So great to see everyone here. I'm here in lovely London, and looking forward to the conversation.
Yeah, so we were working on the Health Hub position paper together, and I am Anya. I'm currently in India, and I'm part of the community, or the community developer role of the SI Network, and we welcome you here today. Kyla, do you want to give us a bit of an intro around the purpose of this session?
Sure. So as I mentioned previously, we decided as one of our first steps as a healthcare hub to write a position paper. As a core team, we have lots of flexibility in what we want to do and how we want to engage with the community. And we thought a position paper would be a good way to do that. But I mean, there's like 3 or 4 of us on the team, right? So how do you write a position paper about a topic that's so huge and also appeals to a global audience? So we gave it our best shot, and we did the best we could to kind of give something that was good enough to go. And then we wanted to offer as a draft, as a first version, and then we wanted to have a session to kind of engage around the topics and the ideas that we presented in the position paper, if there's any feedback, if there's any changes we need. And then the next step is to start thinking about, okay, now how do we action these concepts? How do we learn from each other? How to move to a more systems-based approach to health and healthcare challenges, and learn in that space together. So we'll spend a little bit of time today talking about the paper and the concepts in the paper and the things that might be helpful or that we maybe missed. And then we're going to talk about, okay, how do we, because we always talk about how healthcare people are very practical and very, want to know how to do things. So we are going to have conversations about like how we actually do this work. So that's the plan for this next hour.
Yes, and before we dive into that, here's a very brief intro into the SI Network Health Hub. And it's a space where we bring people together in health systems to teach and to co-create and to bring people together for discussions such as these around how systems thinking is much needed in healthcare. And to join the space, for those who are new, we would really welcome everyone to become a member. Later on, you can click the link here where we will, where you will end up on the feed of our page. And you can also introduce yourself in the introduction section of that page. And just to start off with a very short warm-up, just to get everyone familiar with the Miro board. I shared the link into the chat, and we just want to know where you're currently zooming in from. So we'll just take 1 minute just to see that everyone's on board, and you can place one of these dots on your current location.
This is my favorite part of these sessions. I love this part. And if you're having trouble using the dot, you just kind of click on it and drag it on over.
And if you cannot use Miro, you can always write in the chat and we'll put the dot there as well. And it's always great to see diversity here. That's wonderful.
Great. Well, while everybody continues to do that and we peek over every once in a while and see where people are zooming in from, I'm going to move over to talk about the position paper. So it's a short document. It's got a lot of visuals in it, and we wanted to make it, you know, accessible to most people. And we had to sort of consider what would be most meaningful to a really broad audience. So we broke it down into 4 areas. So we talked about current context. And to give you a summary of what we said in the current context, if you haven't had a chance to read the position paper, is basically the world is changing. It's changing really fast. And how are we going to keep up to all these things that are happening in our healthcare system? And, you know, healthcare isn't really known to be super like up with the times. So, you know, we kind of are all sort of challenged in that area of like, how do you kind of turn this Titanic of a system when everything around it is moving at such a quick pace. We then went on to identify current challenges that might be experienced kind of globally in various systems across the world. So we talked about going back to current context, we talk about changing needs of our communities and people, the rising expectations and kind of the demands on the system as people become more aware, more educated, there's more access, there's more demand for access, there's considerations around equity that we maybe hadn't considered before or we ignored in the past. We have technological considerations with AI and all the digital innovations that are coming in through the healthcare system. And then just generally global challenges of working in a globalized system. I mean, that's highlighted really well with the recent COVID epidemic, right? So, you know, we're facing those kinds of threats, climate change. Those are all part of the current context. And then the challenges that we're looking at, sort of shared challenges, are around fractured systems. And, you know, I'm not sure that there's any system in the world that's kind of, maybe there are, I don't know, but kind of cracked that nut around how do we fully integrate our systems, and how do we, you know, keep these silos from kind of creating problems in our system. We talked about human and health resource challenges. I think that's probably a shared challenge across health systems. And then changing natures of disease, from going to more of a chronic conditions, especially as developing countries become more developed and have access to food, Western culture, diets, all that kind of stuff. So, and then we talked about transitions. And for those of you who have more experience or are embedded in systems thinking, or the Systems Innovation Hub even, we talk a lot about these transitions from reductionist approach to systems approach, from closed fixed rules to open systems for emergence. We talk about organizational centered models versus shifting to patient centered models, and what that, I know there has been conversation and movement towards that, but there's still a lot more work to do in that. And then vertical or hierarchical organization as opposed to sort of networked and ecosystem types of approaches to our healthcare challenges. And then we put a little bit of envisioning things in there. So again, can't really capture all of the transitions that are needed or all of the opportunities that there are for us, but we wanted to talk about integrated care and the goal around that, values-based care, human-centered care. I mean, there was kind of overlap with these a bit, but at some point you're like, I don't really know how to kind of break these apart. But there, we try to kind of hit on everything that we could that made sense. And then really, the essence is how do we make this dynamic and resilient system that we also desire and that we need to have going into this rapidly changing context that we're in. And then this concept of health networks and sort of a networking approach to kind of address some of the complex and wicked challenges that we face. So we maybe haven't had a chance to read the paper. If you have, either way, we'll leave the mural for you guys to play with this. But there's some stickies that we've put, some purple stickies that we've put beside the paper. And we would love your input as this session goes on, or after the session, if you guys feel like we missed something, or there's like another topic we should add, or we need to make something more clear. We're hoping for a mix of people that maybe don't have a lot of experience with this, and does it make sense to you? Does it resonate with you? And then we're also looking to the experts in the room that could also sort of put in your expertise and your insights from your experience. So all feedback is welcome. And if you think it's super and great and we don't need to make any changes, that's great too. But any feedback we would really appreciate. Is there anybody else on the team that wants to add to my introduction of the paper? Joss?
No, that's in 3 minutes, I think that's as good as it can get, right? Very, very high level, but I do encourage people to read it. As you can see, it's not in depth, it's not boring, it's quite high level, and it covers a lot of ground, and really, I think, touched upon those key changes that need to come about. So I encourage you to take a look through it for sure. Yeah.
Even feedback that resonates with you, if it resonated with you and you have a story to share with us, we would love to hear more from you maybe in the future. And this mirror board will also be open for you to really take time to give feedback. So best to save the link somewhere as well.
Yeah, I think it's also best to take it as kind of a narrative, a story, because trying to get that overview, it can't be much more, right? And it just kind of gives us a way of looking at that bigger picture, and also that section around transitions, I think, is really, really good. But it's quite abstract. So then the question is, how do we bring that down to ground? What does it mean in practice? This user-centered, patient-centered approach to healthcare, for example, but all of those have real, well, it'd be good for us to be able to kind of unpack the reality of these things, should we say? Yeah.
Right. So one of the questions we wanted to ask of you is, when you look at those transitions, when you look at, moving from a reductionist approach to a systems approach, closed systems to open systems, hierarchies to networks, we wanted to get a sense of, in the room, of where your experience is and that kind of thinking or that kind of work. So we have a little question there, sort of based on this paper. What level are you in terms of system approaches? So you're not familiar with this at all, and you've kind of just come in to sort of try to understand this work. You're starting or are quite familiar with it, or you've applied it. And then have you applied it where you feel like you've really hit it out of the park or nailed it, and like we did something that was really meaningful with a systems approach. So yeah, just let us know kind of where you are on the spectrum, so we kind of know who we have in the room.
I had a question. Is it with respect to healthcare or anywhere?
It's in respect to healthcare, probably,
Okay.
or maybe not. I don't know. What do you guys think? Probably anywhere.
So I would think for familiarity and some of the let's see, familiarity and maybe some basic have applied it anywhere is fine. I think for the applied successfully, I'd be interested. Yeah, and you can write it right in your sticky note. Like I've applied this successfully elsewhere, like another domain, or I've applied it in healthcare.
Right.
I actually saw somebody put have applied in university. So that's actually a super helpful comment.
Mm-hmm. And it looks like we've got a pretty good spread across the group. So that's actually really good. We were hoping to have a diverse room of experience and expertise in this. So it's really great that we have people across the spectrum. Yeah, applied it in IT. So yeah, that's what I'm starting to realize. It's like, why don't we have more IT systems thinkers and engineers in our healthcare system? I think they would be really helpful for a lot of us. That's great.
I have a question.
Sure.
In terms of healthcare, are you also thinking in the context of public health? So disease surveillance, pandemics, all of that.
Yeah.
It ties to the previous question about animals, because diseases are, dog bite.
Right.
The person is the entity who is impacted, but you have to also go and probably figure out if there are other dogs in the area. That might be an issue.
Right. Yeah. Yeah, that's a huge systems approach, right? To health, this One Health concept. Yeah, it's massive. And again, really speaks to sort of that global challenge that we're all interconnected, and, you know, we exist in systems, and healthcare isn't really all and everything to health. Great. Okay, good. So the next part of this session is that we're going to break into smaller groups, breakout rooms. And what we want to do is to have a conversation about how we could bring these concepts to life in subsequent meetups on this forum. So if you have experience that you could share, if you have a story, if you have questions, if you had like, if someone could sort of like explain how networks function in systems innovation or systems change, that would be something I really like. So it's a very open forum. It's a very open discussion group. But what we're hoping is that we generate some ideas for what kind of topics and what kind of conversations we'd like to have as a group going forward in systems approaches to healthcare. So what are the opportunities we have to learn? What are the together on? And like, what can people, who do you think could contribute to that conversation? And really just whatever general ideas or, ideas you have about how this group could become the most helpful to you, or what you would want to use this group for. So Anya, are we going to go into 2 or 3 groups? 3 groups. Okay, so you'll be selected into 3 groups. And then Angela, Janine, and I will facilitate the conversation, but hopefully we all just have a chance to share and learn from each other. So we'll go in there for about 20 minutes, and then be prepared to share your insights when you come out.
Has everyone received an invite into the room? And I'll just be here on standby. So have we got everyone? I think we've got everyone back into the main session.
Okay.
Would group 1 want to share your insights?
Does anybody in my group want to share insights, or do you guys want me to do it? You say. Unmute yourself and declare.
Go ahead.
Okay, all right. So lots of insights, lots of a mix of experience. And so I'm not gonna speak for the whole group, but I'll share what my insights were from the conversation that we have, and based on nodding of the group. So I kind of thought that that might be a good indicator of key insights. So we talked about culture of fear and risk in healthcare. That's kind of pervasive across the entire system. So there are situations where safety is paramount, where, you know, things absolutely can't fall through the cracks. There has to be, you know, checks and balances across, but that doesn't need to exist in the entire healthcare system. There's spaces for that. And then there's also space for where we need sort of less risk, less fear, more experimentation, trying new things, having a little bit more freedom to play around with new and innovative ideas that won't cause any risk or harm to patients. So we talked about that as like a kind of a pervasive mindset that we could work on shifting a bit in systems approaches. Henry had a really good insight into, like, now that the resources are so, human resources and financial resources are so challenging in our context, it's actually spawning more creativity and more innovation and more ideas, because you just have to do things differently. We can't do things the way before. So there's a bit of an opportunity here in that space. And then I asked Henry as well, what was the most, he's been working in this space for about 20 years. And I was like, what is the most key, what is the most important thing, or what's the thing that you've learned the most over the last number of years? And he was like, defining value. And, you know, redefining value and what's actual value in our system, and how do we move to creating value, which I thought was really interesting. And if anybody else has any from our group, please add them in the chat. That would be great. That was anything that kind of hit home for you. If you could add that into the chat, that'd be great. So thanks, group one. It was a really good chat.
Great. And we'll move to group two.
Great, thank you. I'll do the same that Kyla did. Does anybody want to say anything first? And I'm glad to do some summary across all comments. Okay, I'll go, and then you guys can add if I miss something. So we had a great group, very diverse in our geography, and also very diverse in our backgrounds. So newcomers, people who've been working in this space, data people. One of our group members actually really comes from the criminal justice system. So really great diversity. And so some common themes across what everybody said is, and regardless of country, so whether it's public or private system in orientation, right? UK versus the United States, for instance. But we had other countries, Spain. We had one woman who works with the World Health Organization. So lots of perspective. So fragmentation of the system is there. It's very fragmented. It's hard to get traction on changing the whole when we're this fragmented and we each only work in our space. I'll drop down to the last couple bullets in my post-it and then go back to the second one. In that context, sustainability of change is very difficult, and leadership, regardless of whether it's more of a public healthcare funding or privatized or commercial, leadership doesn't see a system. So the example cited in the UK where, you know, NHS pours a lot of funding and actually has a lot of initiatives that are very system thinking oriented, yet there seem to be barriers in making lasting change, and that the people who are boots on the ground don't necessarily have the space they need to make lasting change. And then in the United States, similar but different problem, where people are trying to stitch the system together, but as we reflect upward to get attention, we kind of hit a ceiling, and people just don't hear it. And related to that, yeah, sustainability leadership, not seeing it. So then I'll go to the second bullet, integrated care. So it seems to be a pervasive challenge, and it's not just across care settings. Like I go one hospital to another hospital, do they have my record? So the woman in our group who works with the World Health Organization was able to comment on Spain and Turkey, you know, things they're able to do well. Not everybody can do that uniformly, but then also we have to expand beyond from one clinical setting to another. So clinical setting to community, but also across different systems. So across healthcare system to the criminal justice system, for example. And an underlying thread there that came up, which I see a lot in my personal travels as well in healthcare, is behavioral health and mental health. So that got a quick mention. Group, did I miss anything that you think you'd like to add? Nope. Okay,
Otherwise, we
thank
can-
you. A great discussion, group.
And we'll go to group 3.
Yeah, would anybody like to talk to group 3 in those conversations, or should I make a start? Okay. I think what I really valued about that conversation we've just had is the primacy of lived experience in all of this, that it isn't just about kind of efficiencies, and it's also about how frustrating it can be when you're trying to navigate through a fragmented healthcare system, but also the real awful risks sometimes of the chaos that doesn't do enough early intervention, that doesn't join up care. And I think somebody has posted a really important film about the risks of that in healthcare that maybe we could also watch and learn from. There was a few things about, yes, joining up the information that we have, but there was also a few people made the point about how important this perspective is to include all the social determinants of health and well-being into the model. That's often missing sometimes from the narrative. And the importance of bringing in those other sectors that can really help support the functioning of our healthcare system around those social factors. Would anybody else? Yes, Sudesh.
Yeah, so I just added few more because I didn't get time to talk about them later. What I found with my lived experiences and now whatever I'm seeing happening in India, there's a lot of misinformation, and also the scientific temper is missing. So I feel these two are very important to be included in the paper. Because if we do that, then a lot of cases will not come into healthcare. There is a lot of chaos happening in the system because there is so much misinformation, and especially there's no scientific tempo, because of which people go for pseudoscientific kind of treatments, which could save costs, like, because sometimes most of the times the treatment gets delayed because people opt for such alternative healthcare systems. So that is something which should be included, I feel strongly.
Yeah, I could
Thank you.
maybe say a word also on Shilo's in that group. I think there's a bit of a theme in this event and in this hub around the value and benefits of seeing the different systems in the different countries. And you might think that'd be the same across, we've got 9 thematic hubs, energy and all these other ones, and governance, and it's not as prominent in the other ones. So it's quite interesting to see it in this group, how people seem to be getting a lot of value from seeing how things work in different countries. Actually, this afternoon I was in a meeting with innovation lead in a city in Sweden, and I was asking, what's the main challenges you have there in the Sweden? She was saying healthcare. And an interesting dynamic that I knew nothing about. She was saying that the healthcare system, the public healthcare system, hadn't really innovated and adapted in response to going online, and the private sector had. And essentially all the clients, should we say, the public sector kind of moved to the private sector online, and the public sector was no longer getting the funding that it needed. So I've never heard about that dynamic, but it's an interesting one in Sweden. So I think it's interesting the way we can learn from these different experiments, these different healthcare systems in different countries.
Nina, do
Yeah,
you-
it's funny when I work with health teams, they're always like, yeah, but we're different. Our problems are unique. We're so special. We're a unicorn. And you're like, no, everybody's got a lot of similar, there are specific things, but there's also cross-cutting things too. And, this sense of like frustration around like things aren't working and things aren't getting better just globally in healthcare is like probably a good foundation for these conversations, right? Like we're
Yes.
almost where we're like, we don't know what else to do, so let's try systems approaches.
I think the comment about leaders don't see the system, I don't think we promote leaders that see the system. I think we promote leaders who are good at a particular transaction that are only there to see one particular thing and deliver one thing. And I think that's the biggest shift that we need, really. Yeah.
I think groupthink is real, and having been in an organization for a while, they expect a certain way things work, and they're not open to new ideas, which I'm so surprised. Even if it's actually you should be first looking at other sectors, what innovations are happening there to bring it into your sector. But no, it's like we are different. We have our blinders on, and we'll do it the way we always do. That's a big challenge.
And I think most leaders rise up out of their physicians, their nurses, their healthcare provider, and that training is extremely linear and extremely reductionist, right? So that's why I said in the beginning, like, I love this idea of getting like system engineers and, different perspectives in that group, because I think we just a culture that's been indoctrinated into linear thinking, which again makes sense when you're doing surgery, but maybe not so much when you're, trying to mobilize or, do systems change. So fascinating. Okay,
And
we've only
Maybe
got,
one.
go
we have
ahead.
a hand raised. Go ahead, Anne.
Yeah.
Yeah, sorry, I'm just going to go back to the point about leaders. And I think, when you're looking at systems, it's very complex. There aren't simple solutions. Sometimes there can be simple rules, but not always simple solutions. So as a leader, it's much easier to put your blinkers on and focus on, it feels easier, right? It feels a lot simpler to just look at your one area and not overcomplicate things. And I think as well, it's, to your point, Kala, that you made there, unless you've come up through to your leadership position, having the advantage of being a little bit on the boundary of things and seeing different areas and how they connect together, sometimes the system isn't clear. It's not always obvious that how things interconnect and the interdependencies and the patterns that happen in systems. So how do we raise that awareness, and how do we educate people or build that awareness among leadership? And also, just one last thing, Big Four consultancy firms do not promote systems thinking, and there's a big there's a big pervasive influence, certainly in the public sector, of a lot of organizations in Ireland anyway, and they are very much promoting kind of a transactional approach. See a problem, oh, we've got a quick fix for that. Let's not look at the bigger
Right.
picture. Okay.
They have a playbook. We
They
have the
have a
silver
playbook
bullet
that
to
doesn't
solve
work.
your problem. Yeah.
Yeah.
So we've only got a couple minutes left in our hour together. So a few kind of ending things. Please, in the stickies, put in what kind of events, topics, training, conversations you would like to have in this community. Now you can see sort of the wide range of people that we have access to, lots of different thinkers. So what best way might we use this space to kind of offer up new ideas or problem solve together? We talked about people maybe bringing challenges that they have and kind of using everybody's brain power to kind of think through systems approaches that might help with those problems. So that's an opportunity as well. Let us know if you've got something like a case study you want to bring and get everybody's ideas on it. There's also links of where you can find us. There's LinkedIn updates if you join the LinkedIn page, and then you can also join on the SI network, the forum, if you want to sort of join as a hub member and get more specific alerts to the things that we're doing and the conversations that we're having. And there's a chat function there too. So if you've got sort of random questions for the bigger group, you can pop those into the chat function as well. If there's any resources that you've mentioned or that were mentioned in your group or things that you think would be helpful for this group, please also put a link in on this page somewhere, or your LinkedIn profile if you want to connect with anybody. That would also be helpful. And yeah, anything else in closing? Any last comments? If you guys want to put in your chat sort of your key feeling as you leave this meeting, that would be great. How, if you're feeling like demotivated, motivated, you know, whatever kind of closing feeling you have as you leave, that would be great to give us a sense of if we actually delivered something that was helpful and meaningful for you today.
I think we need an unconference. People seem to have lots of things to talk about in this group.
Yeah, we might need a whole day. Multiple days.
And,
I really liked the idea. So I loved all the ideas. You know, so some of the defragmentation, the specific solutions are things we could tackle. But I think we struck a chord on this idea of how do we talk to leadership, and how do that comment about if you have not had the opportunity to work on the boundaries within your system, it's really hard to see the system. So how do we break through that? I thought that was very insightful. So if there's some energy around that, that's something we could continue to discuss in addition to specific problems.
Yeah, I just read a paper by Griffith University that talked about enabling conditions, and culture and leadership were definitely one of those enabling conditions for improvement and innovation to happen. So I think it's like very dead on with, you know, the challenges that we're all working in healthcare systems. And we could definitely have more conversation around that for sure.
Henry,
One of
you have your hand raised.
Yeah, well, I just put a link to a book I've written for 1.5 years, which, well, at least describes my experience with this topic. So it's not a very scientific, but it's very, okay, this is what I came through, and this is the way I approach the system thinking. And so maybe it's helpful, maybe not, but at least the link is in the group on Mighty Networks. So
Great, thanks.
So it's in the hub, or because I don't see it in the chat.
in the hub, yeah, in the healthcare hub.
In the hub.
Yeah.
Okay, awesome.
But the
And
introductions
Sudesh.
and chat, I think, that one.
yeah.
Nice.
So I just wanted to, repeat what I said in the group as to this session is really a healing experience, especially for chronic patients like me who have been through a lot through that healthcare system, where I've seen at the event level what it does to the patients. So such kind of discussions will be, actually help the entire system to improve more and more. And if we get more people on board to understand systems thinking, I feel that's a powerful tool to heal the planet more than the healthcare system. Because like the issues we are seeing with respect to the pollution levels in most of the cities, and that is harming, that is taking people to the system of healthcare. So that can be avoided. So many things can be worked on because we are thinking about systems rather than in isolation. So yeah, this session is really helpful, and I feel we have more of such sessions in the future. Thank you so much.
thank you. The Miro board will also be open, so it's great if you can save the link and you can revisit it in the future.
And Kelly, the article is Challenge-Led Innovation by Griffith University. You can just Google it. Sorry, I was trying to get the link, but I can't. So yeah, Challenge-Led Innovation. Okay, thanks everybody.
Thanks very much.
Bye. Have a nice day.
Bye.
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 Thank you.
Thank you.
Bye.